thousands of patients, hundreds of staff, countless tests, procedures, and life-saving treatments. Good Samaritan's team of healers looks beyond the numbers to focus on what matters most: heart patients and the lives they cherish. No one came closer to losing that life than Vince Marullo.
If I didn't arrive at Good Sam that morning, there's a great possibility I wouldn't be here today.
My husband, Vincent, wasn't feeling well. He was coughing a lot. We went to our family doctor. We thought he had bronchitis. It wasn't going away. They took his blood pressure, realized that it had dropped dramatically. From there, they did tests and realized he had a leaking heart valve. And that's when they set up the tests at Good Samaritan Hospital. And during those tests is when all hell broke loose.
He had a transesophageal echo test because we were concerned that he had severe mitral valve disease and that his mitral valve was leaking so much so that fluid was just backing up into his lungs and he couldn't breathe. He went from the echo lab to the cath lab, and where I did his procedures, and he needed both bypass surgery and mitral valve replacement.
Dr. Deutsch came back and told me that my husband was in trouble.
I know they told my wife at one point to find my kids to come on over because they had the time to say goodbye, because they thought it was a good chance that that was it for me.
We had to just step up and do what needed to be done, which is to take Vinny to the operating room, and we rushed him into surgery because he literally was dying at that time.
I was so scared, and I made eye contact again with Dr. Lamandola, and he said, "I've done this over 5,000 times," and just the comfort that brought me was tremendous.
Vince Marullo underwent a 7.5-hour triple bypass and valve replacement surgery, followed by 31 days in Good Samaritan's cardiothoracic unit.
Dr. Lamandola said from the very beginning that it was going to be a 2-step forward, 1-step back process. And he told me that immediately. And as the 31 days progressed that Vince was in the hospital, he presented the staff with challenge after challenge. He had a lot of complications. Within the first week, he went into VTAC. His heart stopped, and the nurses there had to use the defibrillator and use CPR to bring him back.
His post-operative care and all of the complications that occurred were managed as a team effort between cardiology and cardiac surgery. And they were managed quickly, they were managed efficiently, and obviously they were managed correctly because he walked out the door on day 31.
The St. Francis Open Heart Surgery Program at Good Samaritan was launched in January 2014 to bring award-winning cardiac care to Suffolk County.
This is a true collaboration between St. Francis Hospital, the Heart Center in Roslyn, and Good Samaritan Hospital here in West Islip.
This is not just a name change on a building. This is truly bringing St. Francis to Good Samaritan and bringing St. Francis to the people of Suffolk County.
This level of commitment convinced Sandy Kasner to travel from her Lido Beach home to Good Samaritan when she needed valve replacement surgery.
4 years ago, I changed my primary care physician, and when I went for a routine exam, he listened to my chest with the stethoscope and said, "How long have you had this heart murmur?" And it came as a complete shock to me because I'm 67 years old. Nobody ever told me I had a heart murmur.
Because she had no symptoms, Sandy did not require immediate treatment. Instead, she had time to research heart surgeons and hospitals. She met with several before selecting Dr. Lamandola.
Sandy Kasner came to see me at St. Francis just prior to my moving to Good Samaritan Hospital. I think it was literally the week before we moved, and I explained to her that I couldn't perform her surgery at St. Francis Hospital, that I was leaving, and it just wouldn't be something that I could do.
I had already determined that that was the hospital that I wanted to be in because it was small and very personal. And he assured me that the situation would be very similar at Good Samaritan and that the entire staff was going to be from St. Francis.
We did her valve replacement using a minimally invasive technique, and she did wonderfully. And I think that she's probably one of our most passionate advocates.
Open heart surgery represents a natural progression of services for a hospital with a long history of excellence in cardiac care.
Over the last 10 years, I've seen improvement in the staff. The equipment is up to date. We've been able to handle a larger work volume. We're definitely the best in the area and hope to be one of the best on Long Island.
I'm proud to say that we can deliver state-of-the-art treatment with cutting-edge medicine for coronary artery disease at Good Samaritan Hospital, ranging from prevention through intervention, surgery, and follow-up cardiac rehabilitation.
Fortunately, most people do not need the level of sophisticated open heart surgery that Sandy and Vince needed. But for those who do, Good Samaritan offers a comprehensive cardiac center that is unmatched in Suffolk County.
We can take care of you from the moment you enter the emergency department up to and including surgery of the open heart if you need it. Basically, choosing the right hospital makes all the difference in your outcomes.
Providing comfort is a critical part of my job and the job of our entire unit. So I think that's really something that makes us very different from most places. And I think that that idea of a family unit here on 4 North is very, very important to our care of our patients.
Our mission really is to, with integrity, with respect, with dignity, to really take care of our patients as if they were our own. And I think that's what makes it really different here, is that it's really about, we're trying to do God's work. We're trying to help people improve their lives and continue their journey. And I think that's a tremendous story.